things are improving that I didn't even know were a problem.
If you start with a control pause of 3, 4, 5, as you did, a control pause of 5 is breathing for 12 people. Control pause of 18 is breathing for 3 to 4 people.
Oh, there's such a big difference.
Huge. So your observation about maximum pause staying the same, but your control pause is gradually coming up, means that your body's gradually absorbing the carbon dioxide.
One amazing thing that's happened just recently is my feet are getting better. And that's not even something that I ever thought of, because I didn't think anything could ever happen to my feet. But I had the orthotics and I can't wear them anymore because my feet don't spreading out and toes are straightening out.
It was to support your instep, wasn't it? And that's sort of what's...
Yeah. It's crazy. And you sort of can't believe it. You know, you keep on looking at your feet and things.
They're working properly now.
Well, but also my toes are moving position. And I had the, you know, a joint sort of sticking out on the outside of my, whatever that's called. And that's coming in. Yeah. And actually Brona's feet, she's having to get different shoes because her toes are spreading.
Okay.
So it's like her feet were all kind of scrunched up. And yeah, so she used to have a line down the bottom of her foot where her feet, because her feet were sort of curled a bit, even not just the toes but the rest of the foot. And I think that line's almost gone now. So we think that she might have to go up half a size to make room for her more healthy feet.
Oh, that's lovely.
Yeah. And I feel like actually all my fingers are actually straightening out a bit. These fingers have been diverging more and more from this joint. And now they're almost together again. So presumably that something was going wrong with these joints and these fingers. And so really, basically I'm having sort of changes in my body, cleansings, whatever, all the time, all different things, you know, one after the other. And it's really crazy, but it's very exciting. Yeah.
And you were saying to me that you had like sort of a list of things that you wanted fixed, but your body's list of what that is like in a totally different order than what you thought what you wanted.
Because the most pressing thing on my mind is losing weight, which hasn't happened yet. But all these other things are happening. So I know that in the end that will happen. But yeah, I have put weight on, so that's good. My body and I have different priorities.
Did you want to say something about what it was like living before you started this?
Well, it was just a big struggle. I tried, obviously, doctors and even alternative GP. And, you know, you could have little bits of help, but nothing really. And in the end, they tell you you're actually okay. And I've got things that I really, really want to do, and I just couldn't do them because I need to sleep a lot during the day. Whenever I got a chance, I'd sleep. And I wasn't actually so aware of the breathlessness, and I think it was just normal, so I wasn't so aware of that. I've actually become a lot more aware of how breathless I am. But yes, painful feet, pains all over the place, digestive trouble, you know, struggling a lot with anxiety. Looking back, it was very tough.
Mental clarity type thing.
Oh yes, it's really losing my mind. It really felt my mental process is really decreasing.
I remember when I was at my work realizing that I couldn't concentrate enough to sort out papers into order, into piles. I kept mixing things up. And then I realized I really wasn't able to concentrate.
Of having to drop off things out of your life because you just can't deal with them. Just trying to prioritize.
How's it been for you, Phoebe, having your mum with a higher control pause compared to how it was before?
Well, I definitely feel that mum can get a lot more done. She's doing a lot more things, like getting out in the garden more and think just a general improvement in mood as well, and more energy, I would say.
Yeah, picking things back up that I had dropped and doing more things. Yeah.
When I first met you, your control pause was extraordinarily low. And your maximum pause, I think the best you could do was late teens, around 20. Is that right? Something like that, wasn't it?
Yeah, I think it was below 20, yeah.
I think, wasn't it, the very first time, wasn't it like 12 or something?
Yeah,
right.
Yeah.
Okay, so yes. So then you persevered with workshop after workshop, follow up.
I did the beginners one quite a few times. I think maybe 4 or 5 times.
Yeah.
I needed a lot of support at the beginning. A lot of support. But at the beginning, oh my goodness, it was really, really hard. I couldn't have done it by myself. It was hard to believe it was going to work. My numbers were so low and it was so hard. I wasn't able to do walking pauses for a long time, months and months.
Yeah, that's right.
Started doing walking pauses when we had the individual sessions, the girls and I with Vladimir and Marcel, just suddenly able to do it. That's made such a big difference. That's fantastic, doing the walking pauses.
Okay, good. So what are your pauses now? You say your control pause is around 18.
Yeah.
And your walking pauses can get as high as what?
40.
Okay. And
once I got a 50,
okay.
but that's, yeah.
And your sitting pauses?
About the same. Like, so what happens is that I get up to getting in the 40s for my maximum pause, and then it all goes back down again. And it's interesting because the first time I got a 40, I had a really severe cleansing, and they were down for ages after that. But now I can get 40s for maybe 3 or 4 days.
Okay, great.
And then it goes back down. Then I have a cleansing. So you can see how it is changing over time.
Yeah. The
first time I got the 50, I had the most horrific rash afterwards.
Yeah.
Oh my goodness.
That lasted for a few days, didn't it?
It was so bad. I was taken completely by surprise because in my mind I kept thinking I won't have bad cleansings because my numbers are so low. But this was like over a third of my body, big areas of raised redness with very bright red spots over that. And whenever I practiced, those red spots would like flare up like fire. It's just like, oh my goodness, it was just absolutely terrible. I think that's the worst cleansing I've had, that rash, that itchiness that is just more pain than itchy. Yeah, and it was just over so much of my body, it's hard to avoid it. Obviously, that was a good thing for me, get rid of something.
Well, something happened. So that anyway, so it's taken you sort of 10 months to get up into the 40s.
Yes. Yeah.
Okay. All right. Well, that, you have been quite a trooper. Amazing to just continue with it, actually. But I mean, you can see it paying off.
And what's the alternative? It can't go back to what it was. And I've tried so many different things to help. Mainstream medicine things and alternative things, and nothing has. So, and once you've got something that actually does help, and it helped right from the very beginning. I had improvements because I watched a podcast with Christopher and
that was James Dell.
And then I read a book called Breathe, and so I started taping my mouth at night. That's all I did, and my digestive symptoms improved out of sight. It was so, and that's hard to believe, when you just tape your mouth and you have this big change. You think, is this coincidental? Can this really be? So right from the very beginning, I've been encouraged by improvements. It would be hard if you didn't have things to.
Oh yeah, very difficult if there's nothing you can see that's improving. No benefit.
It also surprised me at how hard it was to start taping my mouth. Like, you think, oh, this will be okay, I can just breathe through my nose, but I had a really strong reaction to it the first month or so. And then I also would wake up in the middle of the night and take it off, but not really wake up. So I'd wake up in the morning and all the tape would be all tangled around my fingers. yeah, it's interesting. Just keep on going, and I don't do that anymore. It stays on all night.
And
so.
Phoebe got her numbers up pretty quickly.
So Phoebe,
So
tell me, what were you like before you started your practice? How was life? What was the quality of life?
I think the things that I mainly noticed was having anxiety and fatigue, and also I had the persistent sore ear that would come and go all the time, and that was really painful and hard. And then also I've always had problems with constipation and things like that. So that were the main things.
Yeah. But the constipation and the fatigue and the ear thing were like debilitatingly bad. You know, it's not just Phoebe just would have to sleep basically all weekend.
You used to sleep all weekend, yeah?
Yeah, pretty much. So still struggling with that. I think I'm noticing the fatigue more now as a problem as I'm starting to feel better. Before, when it was worse, obviously I thought it was bad, but you were just like happy that you could sleep. You're like, oh yes, I feel tired, I'll go have a sleep. Whereas I think now that I'm starting to feel better, but I still have quite a lot of problems with fatigue, I find it more frustrating because I do feel better and I do want to do things more. The things that have improved the most so far have been the anxiety. I was on medication for anxiety and I was able to come off that. So that was really good. And yeah, just thinking back, and I used to have a lot of anxiety with I used to bite down on my thumb, calm myself down, and I don't do that anymore.
So you tried to come off medication beforehand?
Yeah, and that'd be okay for a bit, and then you would just sort of crash down again. Whereas now I have the same disability that I had when I was on the medication, but just less anxious in general as well.
What control pause did you start with?
It wasn't that high, was it? I think it was in the early teens, maybe.
That's what I remember.
Yeah.
Around 12, 13, something like that.
Yeah, I think so. But I think I also found it hard to know what my control pause was at the beginning, because when you said, when you first need to breathe, I was like, well, that's as soon as I start holding my breath, I want to breathe. So I think it was around 12. And now I think it ranges between 24 and 30 sometimes.
Okay, and what's your maximum pause now?
The most average would be 80, but I have got up to 2 minutes, I think, about 4 or 5 times.
So you're between 80 and 2 minutes?
Yeah.
Great.
The biggest improvements at the moment have been the anxiety, and I've also always had really bad circulation. I had my feet would be purple all the time.
Cold and
and now it was when I got to 1 minute, my feet changed colour.
Do you remember the waves of heat?
Yeah, so I was felt really hot in my feet, and then over the next month, even this was as I was just walking around, even when I wasn't doing practice, I would feel like someone was pouring hot water over my feet, especially in my heel. So I think there was obviously blood coming in that didn't, wasn't circulation returning. So before it would be 80% of the time my feet were purple, and then 20% of the time they were normal, the same colour as the rest of me. And now I think that's kind of switched. So 20% of the time they go purple, and it's often when I should be wearing socks or something to get cold. And then 80% of the time they're normal. So that's been a really, really good thing. I hadn't put that on my list of things that was my problems.
But lots of things you just live with and you don't think of, you just think that's just you. And then when they start improving, it's amazing.
What's your quality of life like now by comparison?
I think it is a lot better, but still things to improve.
Yes, I think that's right. As you've got better, you've become aware you're not living the life you want to live because of the fatigue and everything. And so there's that sort of level of frustration, whereas before it was just survival, whatever.
Just manage.
Yeah.
But also I had problems with having a really high heart rate, which I think is
that's right. Yes,
is still kind of an issue as well. So I'm just still working on that.
Marcel was really helpful for that, wasn't she? There was times when Phoebe's heart rate was really, really high, and we just couldn't seem to get it down. And it was great to be able to contact Marcel, and then she worked with Phoebe to try and get it, because it was well above 100 while she's completely at rest.
Yeah.
That's been amazing to see that coming down. And Brona had that as well, high heart rate, and that has improved a lot.
And another thing I noticed as well, is increase in concentration. I feel like my reading comprehension has gone up a lot. I'm reading more like technical stuff at work, I can actually read through it and understand it, whereas I think before what I was doing is I was more just kind of loosely skimming it because I couldn't actually concentrate for that long to read the whole thing. So that's been a big increase in my attention span. Yeah.
So you're able to do more as well now?
We often talk about that, like, she does something and then she does something else.
Yeah.
And you think, oh, you don't need to sleep between these events.
Yeah, get you in multiple things in one day. You're like, oh, this is crazy. So I'm still having naps on the weekend, but trying to cut down on that. But yeah, definitely able to get more done than I was.
Yeah, it's just a matter of keeping going and waiting for the control pause to go up over 30.
Yeah.
It'll make a difference.
Yeah. Yeah, and I think I need to do more of the stepping pauses as well, because I tend to just do the sitting ones. But I think,
yeah, I've found it just like night and day, do the steps, because you feel that once you've done your maximum one of them and you stand there, I just feel like it's effect over my whole body. It's just amazing to really feel the oxygen getting released, or
Yeah.
It's just great. Yeah.
Well,
so
40 steps is equivalent to a 60-second sitting maximum pause in dose.
So why is it easier to do the steps, do you think?
Well, you're asthmatic, and for some reason it doesn't have the same pressure on the lung.
Yeah.
And so it's important to continue doing sitting pauses. But it doesn't hit the respiratory center directly either. And so the respiratory center doesn't react so strongly when you're doing steps.
Yeah, that's what I found with steps. I can push further through, when I think, oh, I should, I want to stop. I can actually keep going. I've got a lot more sort of leeway in pushing myself with the steps, I found. Whereas with the sitting ones, I just, once I get like desperate to breathe, that's it. I really can't.
That's the respiratory center. A lot of asthmatics find steps easier. Not all of them, but a lot do. So asthmatics, and they can't get their pauses up, quite often we'll go for steps until they get decent numbers with steps, and then we'll revert back to using steps to help to get the sitting pauses up. But in your case, you couldn't do steps because you couldn't do that kind of physical exercise.
No, I just get a terrible pain in my chest and just horrible panic. Yeah, I couldn't do them.
Yeah, well, I didn't do steps for quite some time. I started with sitting pauses as well for quite some time until I went on to steps, because of how I was physically at the beginning. I was very weak.
Yeah.
Verona really likes doing the steps, and she's asthmatic as well, so that would make sense.
Yeah. So, how have you noticed the differences in Phoebe, Nicola?
Well, for one thing, I do like to see her feet not looking like they might need to be amputated, which was terrible, and her hands as well. Similar thing. She's got a better mood for sure, more relaxed, a little bit less grumpy. I think you could say the same about me. And also being able to do more is such a relief. Terrible, so young, not able to enjoy your life. It's
something I really want to do, but then not end up doing.
You're very energy poor, so you've got to be very careful about how you allocate your energy. Because whereas you're getting a much larger bank of energy.
I think before I was able to manage working full time, but that's basically all I could manage. Yeah,
that's right.
Well, that was quite a lot, all considered. With the budget you were on, you were actually overextending.
Yes, definitely. Yeah. And she looks so pale so often, with really dark rings under her eyes.
I think my skin has improved.
Her skin's improved so much.
And not having much problems with acne or anything like that. Yeah.
That's gone too, yeah?
Yeah, I think that I see them come up and then they just go away in a few days. Yeah.
Breathe it away.
Yeah.
We keep saying, if anything's wrong, we just say, hold your breath.
Yeah, and just becoming more aware of my breathing and other people's breathing as well. So now when I talk to someone and they're breathing through their mouth, I want to say, stop it.
I know, you're killing yourself.
I know, it's really difficult. Yeah.
And I'm just so happy for Phoebe because she didn't have asthma. I'm just so happy she got her numbers up so fast. It's just, it's fantastic having that, medication to affect so many systems, and it's really great. I'm really happy for her.
Well, well done,
and,
both of you.
Really. And I was very worried about the constipation as well, because, that just affects so much of your life. Who would have thought if you're constipated, just sit on the toilet and hold your breath?
I know.
This is it. It's crazy.
I know. Being long-term constipated is very taxing on the whole metabolism.
Yes, it's terrible.
Very difficult. They're really difficult.
As usual, you try all the things. Nothing helped except for there was a probiotic we heard about, and that did help, but it helps for a while and then it goes down again. Whereas this is...
Well, constipation is asthma of the colon. So though Phoebe didn't have asthma in the bronchus, she had asthma in the colon.
That's still not 100% fixed, but it's definitely a lot better. And I had, especially one particular week, I had kind of a big cleanse, it felt like, and so it had sort of diarrhea or something. What happened is that everything that was backed up in there all got liquid and all came out. That was really good. I think I've cleared everything out, but still just trying to work through being regular. So
Vladimir recommends that people miss a meal and then they have a salty soup.
Okay.
Yeah, to wash things through every now and again, just to have a wash out, miss a meal, and then have a wash through with a salty soup, a thin soup, a vegetable soup.
Oh, we should try that.
He also recommends beetroot juice. But the thing is, it cleans things out. That's what you want, is to clean things from the inside.
That's something I've noticed with doing practice, is that I feel like my digestive system works a lot faster, which has been, amazing. And I mean, because one of the things that's happened to me was that I was sort of well through menopause. I've backed up again. So
the reproductive system sort of restarted again.
Yeah, I mean, obviously hormones got going again, and so that's unexpected. I didn't expect that.
So how old are you?
54.
Oh, okay.
Yeah, so that was...
Yeah, that's interesting. I've not heard that one before. That's a new one on me.
Oh, really? Yeah.
Yeah.
So I hadn't had a period for over a year. And I had all kinds of hormonal symptoms, and then started having periods. So
okay.
So I was very annoyed. I thought, can't I lose weight? Lose weight and not have that trouble. The other way round. I don't know what my body's doing.
It's funny. But your skin looks a lot better. You look really shiny compared to how you were.
Yes, that's right. My skin has improved. I feel that.
Yeah.
All over, more supple, and
Another thing I noticed, I used to always just eat whatever I'd put on my plate. I'm like, I'll finish all this up, but now actually sometimes, quite often, stop partway through because I get more of that message from my body. So that's really been really good as well.
So you're now eating to kill appetite?
Yes, I think so. Yes. I think I didn't have such a strong appetite before.
Well, you had a lot of nausea, didn't you?
Yeah, I did. I felt kind of nauseated, but I still liked eating because it wasn't tied in so much to my body signals.
Because that's something I haven't been able to achieve. I haven't been able to follow the instructions of the Potato practice of eating just a little bit, all the food suggestions. I've still struggling with that. I find myself eating something where I don't even remember choosing to do it. I just think, oh my goodness, I've taken a bite out of that. So I think if I could only do that, I think that would improve my practice a lot, improve my results a lot.
The main thing for you is to just keep focusing on growing your pores. Don't worry about it. It'll come.
And same with Phoebe, I do find that I'm eating less, even if I start eating. I think 1 or 2 bites is enough. Whereas before I would just eat and eat and eat. So that is improving. So I feel pretty confident that everything will get sorted out.
Yeah. We just keep going. That's generally, if you just keep going, it'll do itself. That's the thing.
And it's just amazing that our bodies are able to address these things. I really did not expect my feet to get better, because that's actually bones and joints and things. I don't know how that's.
Didn't Marcel tell you about her feet?
Yes, she did. Yes. Yeah, she did.
Mm.
Yeah. But it's one thing being told something, another thing actually happening to you.
I know. Yeah.
Yeah, so I just wanted to say that how hard the practice is to do, especially at the beginning. You know, I just keep pushing myself to keep doing the practice. And then there'd just come a point where I go to practice and I hold my nose and I just let it go. I just couldn't bear that feeling. And I'd have maybe a day or two without doing any practice. I'd still tape my mouth at night. And the thing that comes back, I used to have this terrible tightness in my back. And I used to feel that if I accidentally banged against something, it would snap. I was really afraid of what was going to happen because everything was so tight and
brittle.
Yeah, brittle. Yeah, it was horrible. And also it meant, my mobility was getting less and less because I was having to, and that's what comes back when I stop practicing.
Mm-hmm.
I can't live like that. I have to practice. And I think Marcel said, that Christopher says, to come to practice with sympathy for yourself, to be sympathetic to yourself. And I think that's good because I, tend to be more authoritarian and mean to myself about it, whereas to practice and then just see what happens when you do the practice and not be judgmental about how much effort you can or can't put into it. And when I just think, I can't do it, I think just a little bit, just have really low numbers, don't worry about it, has been what keeps me going through the times when I feel like I can't do it. But now that I've got the steps, you see, I've got that other thing, and I think, I'll do steps if I feel like I can't do the sitting pauses. And the steps are just so much more pleasant. Because it doesn't have that horrible feeling. Sometimes I just can't stand it.
Well, on the days that you find it difficult during the sitting pauses, you can finish the set with steps.
Yeah, I've got to get into doing that. I've done that a few times. It's just something I don't think of when I'm doing sitting pauses. But yes, when I did that, that was good. Yeah, that was good. And I did get quite big numbers doing that when I thought I couldn't get them. Yeah. But it's the process of standing up. Often I just let go of my nose.
Well, it'll get easier as your numbers go up. You keep going, you'll be fine.
Yeah, I see that. Yeah. But I still remember that rash. That was so terrible.
Don't feel like, oh no.
I mean, you don't want one of those again.
No, I don't.
No, I know.
Although I think I'd handle it better. It just it felt like it came out of nowhere, even though you'd said that rash is a cleansing thing. And I really didn't think I was going to get anything so unpleasant with such low numbers, such low maximum pauses. So now that I know that I can get all kinds of cleansing with the numbers I've got.
Yeah, well, 45, 50 is when the process starts.
Right. Yeah.
So you got there once and you triggered it.
Yes.
Right.
Yes.
You need to get to 45. So start with doing 45 once a day or once every other day.
I could maybe do that with steps, but what I find is I do my 40s for 4 or 5 days. No, my practice is 4. And then it goes way down and there's no way I'm getting to 45. The maximum pauses are just terrible.
I think I really haven't found it that hard. The first month or two was more hard. I had a lot more kind of panic reaction to holding my breath quite a bit.
And that was when you had that really high pulse.
Yes, but I think, Mum's definitely found it a lot harder than me. I've kind of enjoyed doing practice most of the time, so maybe to do with not having the asthma as well makes it easier. But I find a big variation, sometimes I find practice really easy and sometimes it is a bit harder.
What is your maximums now?
Sometimes I just go to 60. Sometimes I have found it too hard to get past 60, but most of the time I go to 80, 60s when I'm kind of getting lazy and can't be bothered. And also started doing it more at work as well during the day, which has been good because I noticed that my pauses do tend to go down a lot during the day. So 2 maximum pauses I'll do between 30 and 50, and then probably more between 50 and 60 is the second one.
Yeah.
That really improves concentration, I found, doing that. And also I find that if I haven't practiced for a while, I start to feel bad in my chest. So often I need to do a quick practice, I'll sort that out.
Mm.
And when she does her steps, she goes really slow. So
I do slow steps. I like to just pace it and go kind of loiter along and take it easy and relax into it.
Yeah, although I think I remember why I was getting into doing steps and then I stopped doing them. I need to get back into them because I think I did my second one too soon after I did my first one. I was going along and I had sort of a number that I wanted to get to, and I kind of pushed myself to get to that number, and then I suddenly had like a spasm with like a really agonizing pain in my side, and I like collapsed onto the ground. I thought, oh, maybe that wasn't a good idea. So that took me ages to sort of sort myself out. So I think I just pushed my diaphragm a bit too hard and just kind of seized it up. I think that scared me off steps for a bit.
I had a thing in my side, like a mini explosion, sort of a pop happened inside, you know, and I was so horrified. It wasn't painful, but it was a very definite thing that happened. No ill effects have happened since.
Things get ironed out. They go all crinkly. Everything goes crinkly inside. Then it opens out.
Well, I haven't had too much problems with the sitting pauses. When I'm feeling like it's easy, I push myself, try and get to 2 minutes or 100 or something like that. So
you actually recovered from quite severe anxiety. How long would you say it took you to recover from that anxiety?
it was pretty quickly. I used up to the end of my pack of medication and then I just didn't refill it. I think sorting out anxiety was pretty quick, I feel like, in the first month or so. And then just using pauses to manage it. I do get anxious still, but then I just try and do a quick pause and that often sorts it out. I still have anxiety a bit, but not so much sort of out of control, I can't handle it feeling. I don't get that anymore. Even just taping my mouth at night had a big impact on my anxiety, I think. Yeah.
Oh, and the ear, that was interesting because she's had treatment for this pain in the ear.
Kept on giving me antibiotics.
A long time. And the last couple of things of antibiotics, there was no sign of an infection at all, and she still had many, you know. And then Phoebe discovered what was actually causing the pain in her ear. And it was
clenching my jaw.
It was a muscular thing in the jaw. How did you even discover that?
Because I stretched out my jaw and found my ear stopped hurting.
Oh, okay. So it's physiologically changed now.
Yeah, so
not an infection.
No, not an infection at all, no. In my teens, I had orthodontal work done and they like moved my jaw forward, didn't they? And I wonder whether something didn't quite align. It's much better than it was before. But yeah, I'm hoping that will sort itself out more going forward, to sort of solve whatever sort of muscular issues with that sort of causes it to spasm or something.
I'm sure.
But yeah, that was quite a big discovery.
The feet thing really got to me because I didn't even imagine that could happen. I basically didn't even think of my feet as having a problem. I just thought that's just life, that's just, you know, nothing, kind of just something can't be helped. And then things are improving that I didn't even know were a problem. It's amazing. Right from the very beginning, I've been encouraged by improvements.